All right, everybody, welcome back for another episode of the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today, all the way from down under in Australia. So this is the second time we've taken the podcast to Australia, actually. No, she was in New Zealand. We have Tim Gabbett. Tim Gabbett is an applied sports scientist with over 30 years of experience in the field. And he has rather a common sense approach to high performance. He's worked with multiple Olympians and elite sports teams worldwide. He also consults with the military on workload monitoring. He's got 300 peer-reviewed articles, and he's presented nationally and internationally over 400 times. And in a recent study with over 8 million scientists, Tim was named one of the top 25 sports scientists of all time. So I think this is going to be a great episode for anyone listening because Tim probably knows more than anyone else that I know of, at least, about the science and data when it comes to preventing injury, mitigating risk of injury, and performing at a high level. So he's the guy that has all the data on this. I became interested in his work way back when I was in grad school studying to be a PT, and I'm excited to get to learn from you today. So thanks for coming on, Tim.
Yeah, well, thanks for having me on, Brett. Appreciate the invitation.
Yeah. So when it comes to all the work you've done, right? First of all, what kind of got you to be so interested in all of this research and data?
Look, I've been working with athletes and teams for a long time, but I wanted to know that I was progressing loads when I was setting out to progress loads. I wanted to know that, if I wanted to provide variation in training, was I truly providing variation in training? So the easiest way to know for certain is to quantify that, and to quantify intensity or quantify volume. And that's probably what got me started. I wanted to be able to know that what I was doing in training was essentially what I was setting out to do. And so progressive overload, variation training, they were two of the really key things that I wanted to know. And that's probably the numbers side of it. It wasn't so much from a research standpoint, that was part of it, but it was more just, am I doing the best thing by my athletes here? Am I actually achieving what I'm setting out to achieve?
Mm. And so with all the work you've done in this field, what are some of the biggest principles you would say are needed to be followed in order to perform at a high level and also mitigate the risk of injury as best we can?
Yeah, I mean, this is a really interesting one, right? Because everyone's got an opinion on how to stop injuries, and I don't know that we'll ever get to a point where we get zero injuries. And if you read a lot of the research, injuries are increasing every year in a lot of different sports. But what I would say is the things that were important 20 or 30 years ago or 40 years ago are probably the same things that are important now. For all of the new technology, all the new techniques, all the new statistical analysis, all the new methodologies, you need to be able to put a good training program in place. Now that to me that will solve a lot of the issues that we have with injuries and with reductions in performance. If we look at why are injury rates increasing across sports, well, part of the reason is players are over competing relative to how much they're training, how much they can actually prepare. And when you do that,
when you talk about that, are you talking about professional level athletes, or are we talking about like youth and high school athletes?
Well, it could be both, right? I mean, I love professional sports as much as the next person, but let's be honest about what it is. It's not geared towards high performance. It's geared towards entertainment. It's geared towards broadcasters and make it as much money out of the sport as possible. And that's from the organisers of the sport, the broadcasters, the teams. That none of it is particularly geared towards high performance. When you're playing that many games, let's use NBA or NHL as an example. When you're playing 4 or 5 games a week, and some of them are back-to-backs and on the road, and we know how long it takes to recover following high-intensity work. We know how important sleep and a routine is to recovery. Then you have to be honest that playing in those sort of conditions is not going to be beneficial to high performance, and it's probably not going to be great from an injury standpoint, right? So, but we could also, that's professional sport, we could also look at some of the youth competitions, and I see it a lot where in youth competitions you have young kids playing a lot, they're overplaying and undertraining. In my mind, if you're an adolescent athlete, you should be training 3 times as much as you play. 25% of your overall workload should come from a game, and the rest should be preparation for that. But we see it in youth sports all the time, where kids are overplaying relative to how much they've prepared for that sport. And that, if we think of it from a performance standpoint, it doesn't set you up for good performance, and it certainly sets you up to increase your injury risk. So to me, a good training program is key. Now, how do you put a good training program in place? Well, you need to understand well-established principles of training. So you want to understand progressive overload. You want to understand variation in training and specificity, and the individualization principle that the same training program is going to produce different responses for 2 different athletes. You need to understand that if you don't keep a good training program in place, then you're going to lose those adaptations. So the reversibility principle, and then recovery is a key component of that as well. Having enough recovery to get the adaptations you need from the training that you've applied.
Yeah, there's a lot to go through here. So I think one of the big things here is a lot of your work that I was familiar with back in the day is this acute on chronic workload ratios. And so for the listeners, what is this that you're looking at? So what is acute on chronic workload ratio? Why is it important? And why do we want to look at it or monitor these things?
Well, essentially, I look at acute and chronic loads as being analogous to fatigue and fitness. So the acute load is a very short-term training stimulus that produces a little bit of fatigue. And your chronic load is something that you need to apply training load relatively regularly in order to get, and consistently in order to get, positive adaptations. Now, the idea behind acute and chronic loads is you need a little bit of fatigue to come from your training, from your acute load, in order to get adaptations. But it just can't be so much greater than your chronic load, so much greater than your current capacity or fitness, that it increases your risk of injury. So there's this balancing act of little bits of acute load on top of your chronic load is a positive thing, because it helps you build chronic load to higher levels. But when you load much greater than your current capacity, that is, your acute load is much greater than your chronic load, then that's when you increase the risk of the tissue breaking down. So it just allows us, it's a really simple way to conceptualize progressive overload, that we're trying to load a little bit more than our current capacity in order to increase our capacity.
Mm-hmm. And so would this be something like you're looking at 1 day versus a week? Are you looking at 1 week versus a month, 1 month versus a year? Can we look at it in any of those different lenses?
Well, yeah, look, I think 1 day versus a week is probably too short for chronic load. I mean, if we're talking about strength gains that come from neural mechanisms, then perhaps 1 week is enough. You'll get stronger essentially within a week without any morphological changes. So just through neural changes. And it'll vary from sport to sport, I think. Right. So for most average athletes, probably 4 weeks is a good 4 to 6 weeks is a good chronic loading window. And maybe 1 session to 1 week is a good acute window. The 1 week kind of fits well with most sports that play 1 game per week. For example, in the NFL, it's probably a good example. For a marathon runner, though, a 4 week chronic load is probably not enough. Right? Most marathon runners would tell you it takes you probably 4 months to get ready for a marathon. So maybe a 12 to 16 week chronic load is what you should be looking at for those longer endurance based sports. So the concept is going to apply across. It's going to apply across all team sports. It's going to apply to lifting. It's going to apply to individual sports, and it's going to apply to the general population as well. So let's just apply it to someone who has to load and unload trucks every day. If you've never done that, and then within a week you have to load and unload 50 trucks, by the end of the week you're feeling really sore, and you're just hanging out for the weekend. But over time, if you've developed the capacity to load and unload those trucks, then those 50 trucks in a week, it just becomes normal to you. It becomes, well, that load that I'm applying today is comparable with my capacity. So you're nowhere near as sore, you recover a lot quicker, you can do a lot more over the weekend. So the concept applies across a lot of different domains. You don't have to be an elite level athlete for this principle to work for you.
And when we're looking at this acute on chronic workload, what are kind of the key things we want to keep in check, I guess, of, does that mean we should be deloading once every 4 weeks of a training cycle? What is it we're getting from this lens or viewpoint?
Well, essentially what we've got is one part of the training puzzle. When we train, there's two components that we really need to have in order to know that we're adapting well. One is what's the load? The load that we're applying, is it an appropriate load? Now, the only way you're going to know whether it's an appropriate load is when you look at the response. And we all have a specific response, but in general terms, we can say that if we load the muscle with rapid eccentric work, then the typical response is around 72 hours. So before you can go back and do a similar dose of that rapid eccentric work, generally we're looking at a 72-hour window on average, but it could vary, right? It could be shorter for some athletes, and it could be much longer for other athletes.
Before they return to like their baseline performance?
Yeah, and before, so their baseline, or where the soreness starts to dissipate, where muscle function starts to return to baseline, which indicates that muscle is ready to receive a similar dose of training or of load. But unless you have the load response, the second part of the puzzle, the response variable, then it only tells you part of the issue. It tells you that or we've ramped up loads really quickly, or we're progressing nice and steadily, right? So there's two extreme views, but it doesn't tell you how that athlete has responded to that load. So you might ramp up loads really quickly, which in general I would say, look, it's probably not a great idea. But in order to know whether your athlete is coping with that, you need to check the response. And if the response is good, then you might go, well, okay, this is okay for this particular athlete. This athlete is pretty robust and resilient. It seems like they can handle these rapid changes in load and it doesn't seem to bother them too much. But it could be that another athlete wakes up and rather than bouncing back 3 days later and ready to train again, they're still sore. Or their neuromuscular function hasn't bounced back to normal, hasn't bounced back to baseline. So that tells you that, perhaps these big spikes in load are not good for that particular athlete. So you have to look at the load and the response dictates whether you're ready to load again. If it's a normal response, then you go back and you train again. If it's not, then you adjust the program before going back and loading again.
And so in a practical situation, how are you applying the testing of this typically?
Again, it'll vary from sport to sport, athlete to athlete. The simplest way, let's assume we've got no resources at our disposal. So let's say it's the average person that walks into your clinic or isn't with a team, so isn't wearing wearable technology or using any technology. You can quantify load really easily just using a session RPE.
Okay.
And that's just a 1 to 10 scale, asking your athlete how hard was that session today. And then the response variable can be done in a similar way with a subjective scale. And it's essentially asking how do you feel today? And it could be a number of subset questions like how well did you sleep? How sore are you? How much energy do you have for today? So they're more it's a perceptual or a subjective well-being. But if you've got other technology, that's without resources. If you've got other technology at your disposal, perhaps you're using, let's say you're a runner, you're quantifying all your load, your training load with GPS. You've got a wearable, a running watch, and it could be you've got a test of neuromuscular function. Let's say it's a maximal single leg ISO heel raise. So you're looking at your ability to produce force through the calves, which is probably going to be pretty important for a long distance runner. Or if you're a little bit worried about when I get fatigued, I start to get adductor pain. So maybe it's a groin squeeze. Maybe you've got some sort of isometric adductor strength device. Some athletes who have to produce force rapidly and they need power will do something like a counter movement jump on a force plate. So there's variations, but the concept is the same, that you're not ever using one piece of information to make a decision. You're always trying to use at least two pieces of information. You're trying to marry up load and response and context. So it could be that your loads are high, your training loads are high, and you're really fatigued. But the context piece is we're in pre-season. And you go, okay, well, if we're in pre-season, we want our training loads to be high because we only get one pre-season to get our athletes as fit as possible. And if they're fatigued in pre-season, that's a pretty good thing. That's not necessarily a bad thing because if they're not fatigued in pre-season, you're probably not training hard enough. So you might just okay, this is exactly where we want to be. But if you're going into the Super Bowl and your training loads are super high and you're really fatigued, then you might interpret that differently, right? You're going in the biggest game of your career. You need to make sure that by game day you're fizzing and ready to play. So you'll be doing everything you can to bump up capacity through a whole heap of recovery techniques, if you like, or reducing training load where you can. So that the load response, the way you interpret it, depends on context. Where are we, and what are we trying to achieve with our training at this point in time?
Yeah, I think that's a very important concept because I actually had this conversation with a parent a few months ago, their son's a baseball player, and he does fall baseball once a week. And she was upset that he came in for training, and this is kind of his off season, right? It's the fall baseball, competitive baseball is over. This is just stay in the loop, I guess, even though I suggest against that. But she was like, well, he was sore. And I was like, well, this is just fall ball. Like, there's no scouts here. There's nothing going on. Like, he's just doing this to do this. He's not a pitcher. Like, he can be a little slow, sore. And she's like, well, he was slow around the base. I'm like, that's okay. Like, his volume is up. We're creating a stimulus here to get adaptation later on. So when that, in season comes around, he can be fresh and he'll be faster and everything else. But some people are afraid that, especially parents are afraid that making a child sore and decreasing performance temporarily leads to long-term harm, which isn't the case.
Yeah, I mean, there's probably, and I agree with this, if he's in off season and he's trying to get better, then you might actually see a temporary reduction in performance. But when you take that load away and you add in the deload, that's when you get super compensation. The only caveat I'd put on that is when you have these reductions in performance that are ongoing. So, and when they're waking up sore and they can't walk down the stairs, they're going to bed sore and they can't get up the stairs, and it's ongoing, and with a normal recovery period, let's say for a tendon it's 48 hours, it's not bouncing back, it's not recovering. Or if it's muscle and it's 72 hours plus and it's still not bouncing back, then that's probably an indication, well, maybe we've just overdone it a little bit here, so we can adjust the training load. But in general, as long as they're bouncing back within the expected time frame, the expected recovery window, then a little bit of soreness isn't such a bad thing.
Yeah. And now, is there a lot of data too suggesting that muscle soreness actually reduces performance?
In the short term, or
yeah, like if you come in and it's like, yeah, I have a 4 out of 10 soreness today, would I expect that athlete to do not his best that day because he's versus the days he's not sore at all?
Yeah, okay, good question. Yeah, we've done. Well, firstly, I would say, look, there's going to be times where you're going to be sore. If you haven't trained for a while and you try and pick up where you left off, chances are you're going to be sore. There's not a single player in the pre-season that isn't a little bit sore. That it just comes with the territory that when you're throwing a lot of training load at the body, there's a little bit of soreness that comes with that, but what also comes with it long term is adaptation. So you take a little bit of a short term pain to get the long term gain. Mm-hmm. We have done some work where we've tried to look at the relationship between pre-training wellness scores. So basically, how sore you're feeling, how much energy, and subsequent outputs during that day, training outputs. And there is a relationship there that if your pre-training wellness is down, then so too is your training outputs for that day. And there could be a little bit of a mind-body thing going on there that if you're not feeling 100%, you just can't produce it that day. Maybe the best players can override that a little bit, in that maybe they can still put themselves in a state where it doesn't matter how they feel, it's how they act. They can override it. But in general, there is some relationship there. But again, you need to produce a little bit of change. Mm-hmm. You need a disturbance from baseline in order to get the adaptation you want. Now, the bigger the change, the bigger the load that you apply, probably the bigger the disturbance. Now, that doesn't necessarily mean that you're going to get this massive bounce back in performance, but you do need to disturb equilibrium. You need to disturb the balance in order to get change.
Mm-hmm. And so, when it comes to some of these subjective things too, I guess, is soreness a good indicator of change, that we're sore for a day or 2 days? Is there some optimal window, or once you get into a trained state, does that not really matter as much? I feel like for me, like when I work out,
Yeah.
I don't really get that sore unless I'm really overdoing it.
Yeah, I mean, that's probably right too, you know, and for a number of sports, you've got the repeat bout effect. Whereas, and essentially what you're doing there is as soon as you expose your athletes to a particular session, it's typically eccentric exercise, but it could be any session really. That's you go back and do that same session again a few days later, and you can get more work done in the session. You're nowhere near as fatigued, and you bounce back a lot quicker. So you know, straight away, that's an indication of adaptation. Look, maybe soreness isn't the best measure. You know, and I don't know whether I could actually say this is the best measure. This is the best measure. You know, whether it's objective or subjective. And of those subjective ones, perhaps different subjective questions are more important for different athletes. So for me, you know, maybe sleep isn't that. Maybe it's not that important to me, but maybe soreness is, and maybe soreness is not your. Maybe you can kind of handle a little bit more of that pain threshold, if you like. That doesn't bother you too much with your training, but maybe if you don't get your consistent 8 hours sleep and going to bed and waking up at the exact same time, that throws your whole rhythm out. So, and these are kind of questions we don't have answers to at the moment, but like they're good to. I think soreness is probably a good guide. Just as energy or fatigue is probably a good guide, and whether subjective or objective is better, it probably you could make arguments for both.
Yeah. When it comes to rehabbing injuries, and you know, there's plenty of data that suggests we can work through a little bit of pain, and that's okay. Now, and that danger signal of maybe pain, it doesn't mean damage, it just means danger, right? So we're talking some like threat perception, pain science stuff. But when it comes to adhering to load, what are the big key principles there of progressing over time?
Well, look, the principles for rehab are essentially the same as the principles of training someone who's uninjured. So we're still trying to use progressive overload. We're loading relative to that athlete's capacity. Keep in mind that the capacity now when they're injured is a little bit different from when they're not injured. All right, so if we've got, you've raised a couple of points there around injury versus pain, and we can talk a little bit about that. But let's focus on injury first. When an athlete is injured, their local tissue capacity is going to fall to the basement. So we've got a hamstring injury. They can't do what they used to do with the hamstring. Now, as soon as local tissue capacity falls, if we can't load locally, then we're definitely not going to be able to load in a sport-specific way. So sport-specific capacity is going to fall to the basement. It's going to follow it pretty quickly. So the main difference between a healthy athlete and an injured athlete is our priority for an injured athlete is restoring local tissue capacity. So we've got to prioritise that. We've got to calm the tissue down before we build it back up. But we also we don't want to neglect global capacity. Because if we neglect global capacity, then we've got two problems. We've got a local tissue problem, then we've got a global capacity problem. So we're trying to train around the injured tissue as much as possible. We're trying to make things as similar to what a healthy athlete is doing, but just train around the injured tissue. Mm-hmm. Now the goal there is that we're just trying to bridge the gap between the floor and the ceiling, so that when they do go back to full training, that gap isn't as big. That sport-specific loading and global capacity is not an afterthought. Mm-hmm. Now the flip side of this is when you have a healthy athlete, the priority is generally on sport-specific loading. But that doesn't mean we neglect local tissue loading. So we might still be doing sport-specific skills, as an example. So they're still doing whatever reps they need to get in as part of the coach's practice, but we also top that up with local tissue loading. So we do weight room work where we might be doing some eccentric hamstring work, or we're doing isos, or we're doing structural stability work. So these are things, we're prioritizing sport-specific capacity, but we're not letting local tissue capacity fall to the basement. And mm-hmm. if you go to some sports around the world, there's a belief in some sports that you can just train with the ball, and that'll give you all the capacity you need. If you want to
train with the what?
Train with the ball, right? So if you want to be a good soccer player, then you just play a whole heap of small-sided games and large-sided games with a soccer ball. That's kind of sport-specific stimulus, but it's not going to help your local tissue capacity. In order to give and I look at local tissue capacity as being, you want to be able to do the little things well, right? It's being able to handle those smaller loads well in order to handle the bigger loads that are going to come as part of the sport. So local tissue loading sets you up to handle sport-specific loading.
So if we're talking about the hamstring still, this would be like doing some type of like hamstring curl exercise or something, right? It could be
any hamstring exercise, but yeah, like it could be RDLs or Nordics or Swiss ball curls or anything you decide.
Yeah.
The goal here is you're trying to strengthen local tissue capacity. And that way, you're not just depending on the sport and the skill of the sport to develop those qualities. You're saying, in order to perform these sporting skills well, we're going to give you the physical qualities to do them. So we're going to give you the aerobic fitness or the muscular endurance to be able to keep up to the play. We're going to give you the strength in the hamstrings so that when you do sprint to put yourself in the position to score the goal, that you don't tear a hamstring, that you're actually prepared to do it. So that's my take on local tissue and sport-specific loading. They don't operate as an either-or. They're both going at once, but the priorities just differ whether you're healthy or whether you're injured.
Mm-hmm. Now, I don't know how to answer this or ask this question very well, so bear with me. In your mind or viewpoint, when we're looking at these rehab principles, right, of sports specific, like raising global capacity or maintaining global capacity versus local tissue capacity, do you find any differences in maybe people are overdoing one and not thinking enough about the other? And we, like, if people focus too much on just that local tissue capacity and they're not focusing on maintaining global capacity, that this athlete still ends up getting hurt once they go back to sport because we just didn't have an emphasis there?
Yeah, 100%, absolutely. So let's think about it. If you overemphasize local tissue capacity and you don't perform any sport-specific loading, then essentially what that can mean is you've got really healthy tissues, but you're unable to perform the demands of the sport. And the example I'll give you there is sprinting. You can have really strong eccentric strength of the hamstrings. You can have really healthy local tissue at the hamstrings, but there's a saying, and you'll see it float around the internet: nothing prepares you to sprint like sprinting. Right. So if you haven't sprinted, you can be as strong as you like in all of these local tissue areas, but they're probably only going to produce the force and muscle activation of a sprint at around about 40% of what a sprint provides. Right. So there's a big gap between what's going on in local tissue loading and what needs to happen in sport-specific loading.
Mm-hmm.
Now, the flip side of that is if all you do is sport-specific loading and you neglect local tissue loading, then you're probably going to be able to perform sport-specific skills, but you're only one sprint away from tearing a hamstring because you've got no local tissue capacity. Your hamstring just isn't strong enough to handle those sport-specific demands. So both are really important. Like I wouldn't say that one is more important than the other. They both have their place, and this is something that, like, in terms of, do I see it? I see it all the time, and you see it with the chronic rehabber. They have really good early stage rehab programs. Like the people I meet in pro sport and in clinics who are dealing with athletes day in, day out, they have got really good early stage rehab programs that, the world's best. But what happens is there's a gap between what's happening in early stage rehab and then the return to play process, and what needs to happen at the peak demands of the sport. There's either an end point where that athlete leaves the physical therapist and goes straight back to sport. So they're prepared for this, but then they're asked to do this.
Yeah.
Or there's a communication breakdown between the physical therapists and the coaches or the strength staff, or the reconditioning process, that middle period between being injured and being returned to peak performance breaks down. So there's reasons for it. It doesn't detract from the fact that they're really good programs in those early stage rehab, but unfortunately it happens all the time.
And so just to clarify a couple things here too, when we're talking about improving local capacity, we're basically talking about using strength training as a means to improve tissue capacity. Or are there other ways to improve local capacity as well?
Strength training is as good as anything that I've seen. Obviously strength training isn't going to be all things to all people, and the relative emphasis of strength training is going to change from sport to sport. But I would, if we think of extremes, let's say an American football player, their emphasis on strength training is going to be critical. They're going to be lifting very regularly. But let's go to the other end of the continuum for an ultra marathon runner. Strength training is still important for them, right? And this is where I think a lot of people go, no, miles, I've got to get my miles in, the Strava miles. No, you've actually got to get strong. You've got to think about, well, what's the limiting factor here? And for ultra endurance running, like, at the very least, you want to have really strong calves. You want to make sure that it doesn't have to be high volume work in the gym for a runner, but what I would say is you want to emphasize force and power, because it's going to improve your ability to handle those high running loads. But if you don't get buy into that part, it's going to improve performance. It's going to improve your running economy. Who would want to do an ultra endurance event completely in pain if they could do it in an easier way? The distance is still the same, but wouldn't you want to do it with less stress? That's what strength training allows you to do.
Mm-hmm. And so when we look at these differences here too, when we're looking at, local load and strength training, or let me back up here. When it comes to people breaking down that maybe don't believe in strength training as much, is it a tissue quality issue that we're seeing? Is it, the physiology of that tissue? Is it just too much of one thing, over adaptation of certain tissue and avoidance and negligence of others?
It's probably a combination of all three.
Okay.
So tissue, if we think about physiology and tissue quality, they're kind of going hand in hand. So, if we think tendinopathies, you've got an imbalance between breakdown and repair, so that's a physiological process that eventually is going to result in changes to tissue integrity.
Mm-hmm.
So it's either going to be a structural change in the tendon, or some sort of change in functional outputs of the tendon, or a combination of both.
Mm-hmm.
And potentially your third question around, well, is it an imbalance? Possibly that's a case too. So if we strip the word imbalance back to you are weaker in some areas, or your performance is limited by something more than others, then that's probably true too. So if we use the runner as an example, I would be looking at the key things that I need to do when I'm running. And one of the big ones for me, for a runner, is you need to land, you need to load, you need to lever, and you need to lift. Now, in order to do that, you're going to have to be strong in the calves, right? Because as soon as you start to fatigue in the calves, you're going to spend more time on the ground. You're not going to be as efficient with your running, and that's going to it's going to change your performance, but it's also going to change your injury risk. So doing some strength training, and it doesn't have to be a lot for a runner. Like I would be doing 20-minute sessions for runners. It's all about and it's not about worrying about becoming bulky, because they're not going to become bulky.
No.
It's how hard it is to put on muscle mass. So for someone who is running that regularly, they're not going to put on muscle mass that's going to slow them down.
I just had a marathoner that he had 3 stress fractures over the course of a year, and I was like, dude, something's going on here. Like, we need to load your bones. You need to strength train. And he's put on 10 pounds of muscle in the past year, but took 4 minutes off his marathon time, and he was running a 6:52 minute mile beforehand, and then brought it down to, I don't know what that averages out to, but with 10 pounds more on his body.
Yeah. So for runners, strength training, plyos, they're key. They're not only from a performance standpoint, but an example there that you give with the stress fractures, they're going to be terrific for bone health. Running itself, long distance running, is not bone centric. It's not a good bone centric exercise. It's not going to build bone. And what actually happens is the bone becomes deaf to further loading cycles very quickly. It switches off. And some would say, within 20 loading cycles, 20 ground contacts essentially, that your bone switches off. You're increasing load still because you're still running, but you're not getting the positive adaptations that come with that. Now the beauty is that even though it switches off quick, it after a refractory period of, let's say, 4 to 8 hours, you can go back and you can do some bone-centric work. So it could be some strength training. It could be some plyos, multi-directional plyos, and that doesn't have to be high volume. I'm talking no more than 100 ground contacts, and not necessarily high intensity depth jumps or anything like that. They're just pogos and changes of direction, so that you're stimulating the bone in a different way from the cyclical movement of running. So
very interesting.
Yeah, there's definitely like from a bone health viewpoint, strength training is key for runners, along with some plyos.
And then the minimum effective dose versus maximal effective dose. This is a vague question too. I guess there's a lot of this for me today, but what is the minimum effective dose for a lot of people, or how do people go about finding that? Because I think in my world, a lot of people think, or actually I'm going to call out my athlete, Brooke. She's on Team USA. We've hit like a little slump in training right now, but it's like looking at chronically, like she's from 14 to 17, she's gotten stronger almost every week. And like, she doesn't give herself a break, or doesn't want to give herself a break, besides the deloads that I force her to make, but she trains at home by herself sometimes too, and I'm not there to monitor. So, you know, when we look at these chronic things, like at what point, you know, do we say that less is more? Because I think a lot of people think more is more, and it's not.
Yeah, I mean, and this is the challenge, right? Look, I think there's a few different questions in here. You know, does she need more frequent deloads? Is she getting enough variation within her training program throughout the week? Is she still feeling good about her training, or is she starting to feel stale with it? So there's a few different things that you can kind of unpack. In terms of well, where do we start with someone who's kind of plateaued a little bit? I mean, it's kind of a normal response, right? So in that period you described between 14 and 17, she was almost at a point where she could think about training and was going to get better.
Yeah.
And that's such a great time of life, but you know, it's probably just a little window at the moment where adaptations aren't going to come as easily. Now you can struggle your way through it, or you can just kind of pull back a little bit, and sometimes pulling back is effective as well. It could be, and it doesn't have to be a massive unload. It could be, well, let's just drop a set here, or instead of doing three sets of 6, we're going to go a 6-4-2 or a 6-6-4, something like that, where you kind of mentally just changing it up a little bit as much as the physical. So it'll vary from athlete to athlete. So like, I couldn't give you like specifics for this particular athlete, but in terms of the minimum effective dose, that we're kind of relying on systematic reviews and published research in the area, and it varies between trained and untrained and you know, elite level athletes. It also varies from paper to paper. But if we, and for the different physical qualities we're trying to maintain. So if we're trying to maintain endurance, you don't have to do much to maintain endurance. Short-term endurance, you could do 1 session a week at around the same intensity as you normally do, probably a 12 to 13 minute session, and that'll be enough to maintain it. If it's a longer endurance events, it's the same sort of approach, maybe 1 session a week for double the time, but just maintain intensity. Now for strength, maybe depending on where you read, you probably only need one session a week. But if you're a little bit older and you're fighting the effects of sarcopenia, then maybe 2 sessions a week. And the intensity range is pretty broad as well, so it could be anywhere between sort of 60 to 85%. and we're talking 1, possibly 2 sets per body part. So it's not a huge amount to maintain. But essentially what we're trying to do is we just look at the physical qualities and think about, well, how long does it take to detrain some of these physical qualities? And for maximal strength, you can maintain maximal strength for a little bit longer than you can, say, power. And endurance, you can maintain that a little bit longer again. Something like maximum velocity, the training residuals there is probably around 5 to 7 days. So what that means is you're probably going to have to, if you want to maintain maximum velocity or the qualities that come with sprinting, then you're probably going to have to sprint once a week. So if you're a soccer player and you've got a really easy game and you haven't sprinted during the game, and for whatever reason the coach gives you an easy week in the following week, then what that means is it might be 10 days between your sprint stimulus. So you want to try and touch sprinting pretty regularly, but just keep in mind that if you're playing on Saturday and we're thinking about the normal load response for something like rapid eccentric exercise, like a hamstring is going to be fully tested with a sprint, then you're probably going to need 72-hour window between stimuli. So if you play on Saturday, I just look at the lead in and lead out time. So I count my way back: Friday, Thursday, Wednesday. Wednesday's kind of the final time I want to hit max velocity, so that I've hit it during the week and I'm given enough recovery time so that I'm recovered for Saturday. And then when it comes around to the following week, I'm counting forward. The lead out time, Sunday, Monday, Tuesday, is the earliest that I would do it. But if I'm only playing one game a week, then typically what I would do is I would do it on Wednesday and Saturday. I'd keep that schedule pretty consistent, so that you've got 3 days leading into a game, four days leading out of a game. There's your 72 to 96 hour recovery window in between stimuli.
Interesting. Yeah, I talked to a strength coach on here before for the Red Sox, and he was saying, like, in a baseball game, if these guys don't hit max velocity, they'll go out after the game and do like 3 sprints at like 90+% intensity, just so that they're doing that to avoid hamstring injuries, basically. So,
yeah, and the players hate it, but but it's either that or you try and get them back on a schedule as soon as possible. You don't get them straight after the game. Can you get them the next day? Yep. So that they're on a similar schedule to what you would like, and allowing them to have some loading and recovery windows.
And so when we're talking about loading and recovery windows, I want to talk about deloads with you, because I've actually seen a lot of stuff lately in the research suggesting that maybe a lot of the traditional, I don't want to say traditional programs, but a lot of the programs out there, the science is suggesting that we're actually deloading athletes too much for like a week at a time. So what are your thoughts on that?
So the research is saying that the deloads are happening too frequently and also for too long a window.
This is some of the stuff I've seen, like on social media and things, of people saying that, you know, we don't need to deload to 60% volume for an entire week, or that, you know, like old school powerlifting was like, let's just take the whole week off before a meet. And that's not kind of the new school way of doing things.
Yeah, well, look, if you think about an unload, you can systematically build unloads into your weekly schedule just through having variation in your training. So you could have a high-low approach where you might have a low day on Monday, a high day on Tuesday, and then a really low day on Wednesday. And then you can repeat that cycle, for example, throughout a 6-day window. And
like never run a true deload week.
Well, I mean, you still might still might run a true deload week, but it doesn't necessarily have to be 50 or 60%. Now that 50% number, if we use the running example again, it might be a little bit different from strength, but essentially, a lot of the tapering work comes from endurance sports, and they typically look at 1 week, 2 week, 3 week, 4 week unloads, and a lot of it would say that a 2 week taper tends to work out the best on average. It's going to vary from athlete to athlete, but on average, 2 weeks. And what they've also shown is that if you decrease training load by 5%, you'll get a very small bounce back, super compensation. If you decrease it by 10%, you'll get a little bit more. 15, a little bit more. Up to around about 50%, if you have a linear reduction in training load, you'll get a linear bounce back in performance. So 50% is kind of where it starts to plateau out, and you get no further super compensation. So that's probably where the social media numbers have come from. But you can't possibly taper for every event, right? Because if you taper for every event with a 2 week taper, then you're never going to train. So some events you're probably better off just training through them and compete in a semi-fatigued state. And with the view of context again, this is not a major meet for us. It's about just getting into the rhythm of competing again, but really we're looking longer term at somewhere 6 weeks down the track where we're going to taper, and it's a national selection meet, or it's a much bigger meet for us. And we're going to taper there and get the super compensation we need there on the back of some heavy training blocks. Mm-hmm. Look, I think there's also an argument around, you could say, let's say a 4 week training block where you go 3 weeks hard, 1 week easy, and that's your traditional kind of model. But there is an argument out there that maybe if you're feeling good, you train, and if you're not feeling good, you don't train, and that it's kind of auto-regulation or agile periodization. It's you're basically you're listening to your body a little bit more. Now that's hard in a team environment where you've got 50 players, and 30 decide they don't want to train today, 20 decide they do. But that's the kind of the polarized argument there, is that yes, planned deloads are important, and they help you maximize adaptations so that you can try and peak at a given time. But the flip side, the opposite argument is that because there's so many biochemical changes that are happening just from day to day in normal life, and stresses that come with normal life, it's almost impossible to peak for any event in the future. So that maybe you should just be a little bit more flexible with your loading and deloading cycles. I think in reality we probably use both, right? We probably have a plan, but if our athlete turns up and is absolutely shattered from studying all night and a really tough exam, and then we've got a hard session plan for them, and they walk in and they're dragging their knuckles along the floor, then we kind of go, today's not going to be the day. Let's reassess. Let's go a little bit easier. Just get a little bit of load in, unload, make them feel a little bit better, so that they can come back at a later date and train when they're in a state to receive that stimulus.
Mm-hmm. Yeah. So how accurate would you say using RPE is for individuals, as far as, forecasting loads and talking about some of this acute on chronic stuff?
Well, look, I think it's good for individuals, and it is subjective, right? And I think that's probably one of the criticisms is is coaches going, well, look, athletes are going to lie to me. They're going to rate things harder so they can get an easier day. Now, my take on that is, yeah, well, you're probably right, but if they're lying about the RPE, they're going to be lying about a whole heap of other stuff. RPE, them lying about RPE is the least of your troubles. Look, I think there's a few things with it. If you've never trained before, probably the accuracy of it isn't great because you don't have the anchors. Mm-hmm. The first session that you ever do in your life is the hardest thing you've ever done because you've never done anything before. Right? Until you have a wide range of experiences that include really easy sessions right through to really hard sessions, you're probably not going to be as accurate as you like. The more experiences you get with it and the wider the range of those experiences, probably the accuracy is going to improve.
Yeah, that's a good point. Yeah, we don't use RPE a lot. Are you familiar with APRE?
APRE? No, what's APRE?
Auto-regulatory progressive resistance exercise. So basically, I forget who it was that came up with the concept, but it's very simple actually, but we use it a lot for our high school athletes and then our general population people that come in that are new to training. So it's basically, you have, it's going to be 3 to 4 sets, and by definition, there's a 3, 6, and 10 rep max. And so these people are going to come in and you say, okay, we're aiming for 6 reps on this exercise. Now, if you can keep going until you feel like your, form and everything is breaking down and you're getting really tired. And so if they go outside of that window, so maybe they get 9 reps, well, we're going to add 5 kilos to the bar on the next set. And then on that next set, if, they're still trying really hard and they only get 4 reps, so basically it's like plus or minus 2, then we're actually going to just take load over. So over the course of like a 4-week training block, load is auto-regulating itself, and volume and intensity are changing, or intensity is changing itself based on performance.
Is it similar to reps in reserve?
No, because RPE and reps in reserve are very similar. So this is just, you're going to go, so it's like, okay, you got 12 reps, that's way too high. Like, we're going to add more weight. We want to try to keep you around 6, but if you can get more, get more. If you can't get it, that's fine. We're just going to adjust the intensity based on that last set's performance, and you adjust each set.
Okay. And what's the name again? Just
APRE.
Yeah. And what does APRE stand for?
Auto-regulatory progressive resistance exercise.
I reckon there's a godfather of sports science or strength and conditioning or physical therapy out there who just sits up there making up, what's the craziest name I can come up with, the hardest name for something.
Yeah.
Some of the stuff that I'm going to write it down. I'll have to listen back to the podcast now so that I actually write it down.
I'll message it to you after. I'll send you an article on it.
Yeah, thanks. Because there's so many, I'm sure it's the same in other fields as well. But
yeah,
the language that we use, no wonder people get confused, right?
Yeah, no kidding.
Yeah.
Anyways, one of my last questions here I had for you, fitness trackers and fitness wearables. What are your thoughts on using them for some of these things? There's all different ones out there. Like, first of all, which one would be your favorite?
Yeah, I wouldn't say I have a favorite of any of them.
Okay.
Yeah, I mean, I wear a watch when I run, but partly because I can program some intervals into the watch, and it buzzes and tells me when to run and when to stop.
Yeah.
It kind of gives me my average pace across the intervals, and but in saying that, there's a heap of watches out there that could do that for me. So I'm not overly wedded to any wearable or technology, in that I think I think people can get obsessed with it, and it's like the runner who has to start and stop the watch when they start the race or when they finish a race, and they get to the point where they're obsessed with the time as opposed to, well, how did it feel? Just in yourself whether you've run fast or not. You don't even have to look at a watch. But I also have had some experiences with athletes who some of the algorithms and some of these wearable technologies are telling them that they're really fatigued and they need to rest. And then when you ask that athlete how they feel, do you feel fatigued? They say, no, I feel great, I want to train, but the watch says I can't. So they're not. Some of these algorithms aren't validated they're potentially interfering with some great training gains by telling an athlete that they can't train and putting thoughts in the athlete's head when the athlete just needs to listen to their body a little bit and say, well, look, I don't need a watch to tell me that I didn't sleep well, or the watch says I've slept poorly, but I feel as refreshed as anything. I felt I slept really well. So I kind of feel like we can get too dependent on it. And the skill of writing programs, the skill of working with an athlete one-on-one or with a group of athletes and getting them to do things that they might have previously thought they couldn't do, that's a skill that we don't want to lose. That's the coaching part, and that's the part I really love, to be honest with you. So I'm not overly wedded to any of them.
And so as a coach, what things are you doing on a regular basis to account for all these different factors with your athletes?
Okay, I can tell you in theory, what I'm trying to do. I can tell you in practice how hard it is. I've just come back from a pre-season with a team that's, we have 30 players in the team. Each of them have their own sleep habits. Each of them have different stresses in their lives that are going to impact their ability to train from day to day. Some of them, look after themselves really well. Some of them not so much. Some of them are living on their own. Some of them are in stable relationships with family. Some of them are playing and training for a contract. So they're all dealing with different stresses. Now I try my best to get to know each of those athletes, but it's hard, right? We try our best to put recovery. They've got access to the best recovery. They've got access to good food. They've got access to sleep rooms if they want it. And we're trying, and we know some of the background stresses that they're dealing with, so we're conscious of that when we're training them, and we're trying to put things in place that help them and put a program in place that doesn't overload them in ways, and we try and help them off field to deal with those things. But they're only with us, let's say, 8 hours a day. That means there's 16 hours a day where they're left to their own devices. 8 hours where they could be awake, and then another 8 hours where they're sleeping. A lot of responsibility falls onto that player to be doing the right things, and they're young men and women. Well, some of them are 20 years old, or some of them might even be younger than that. So they're making some decisions now in elite level competitions, in an elite environment. We're asking them to be professional about their prep, when a lot of them probably don't even know themselves that well. So in theory, we're trying our best to manage that. In practice, like I'd say that we're just doing our best. We're doing our best to try and create this elite environment for them so they can thrive. But it's not easy.
But basically, it still comes down to, let's just make sure the mental and emotional wheels don't come off, so we tank recovery.
Essentially, yeah. We're trying to keep a happy environment. We're trying to ask them. We're asking them to do some things that a lot of normal people will not go to these places. They won't. You know, I'm talking about a sport that's a pretty tough sport. It's a sport where.
What sport are we talking about here? Rugby?
Rugby league. It's probably one of the toughest sports in the world. These players will put their heads where most people won't put their feet. Right? So, we're asking them to do some things that most normal people won't do. So we've got to create an environment where there's intent and where your mindset to these hard things is, well, I'm going to attack it head on. But we've also got to balance that with having a happy environment where people want to come to work, and you know they kind of you want them to be wanting to come to training each day. So there's a tough balance there.
Yeah, for sure. All right, Tim. Anything else you wanted to add? I know you got to wrap up here soon and get out of here. So, anything else you wanted to add to this conversation for now?
No, look, I appreciate the chat. It's always good, always talking to different coaches about how they approach things, and I've learned something today as well. So,
of course, glad I could help.
yeah. I've learned some terminology that I was unfamiliar with, and look, I appreciate the opportunity to come on and just talk to your listeners, right? So. If they want more information about me, just they can head to my website, drop me an email. I'm a little bit slow on emails, but I do respond. So
you are slow on emails, I think, and getting back to your instant messages.
Yeah, well,
your DMs.
Yeah, I am a bit slow, so I apologise for that. But I will get back. Like I did get back in touch, though, right?
You did.
Eventually.
Where can people find you?
Probably the website's the best place to go, because then they can email me if they like. It's gabbittperformance.com, so GABBETT performance.com, and then on most of the social medias, Instagram. I will see the message eventually, and I will get back to them. But generally, I'm balancing a few things, so it might not be right at that moment.
Yeah, of course, that's respectable. All right, Tim. Well, thank you for coming on. And then, also, we can just give you a push here too. You might be coming to Boston in June, you said, for a course.
Hopefully, yeah. So keep your eyes out for that, because that one's a lot of fun. There's a lot of we cover a bit of the theory, but there's a lot of practical stuff that we do in terms of building programs from the ground up and working together collaboratively between physical therapy and strength staff. And we've also had sport coaches along to it. And by the time the session is finished on day 2, I've had sports coaches running rehab programs. So it's as long as you're prepared to learn some new things and to listen to people, they're always a lot of fun. So yeah, Boston, hopefully in June.
Awesome. Well, again, Tim, thank you so much for coming on. I appreciate your time and all your knowledge you were able to share with us. So hopefully we can have you again on in the future sometime.
Great. Thanks, Brett.
Awesome. Thank you.
"84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit ARKITECTFitness.com. Or if you want to rehab with Barbell Therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.